Good evening, everybody. Welcome all to yet another Facebook live session. I am extremely excited to announce that we are starting our male infertility series, and the platform is going to be this Facebook live session. And today actually marks the commencement of this the male factor infertility series. um, you know when we talk about there is this misconception among many people that when we are dealing with infertility, or if a couple is infertile, we automatically focus on the female partner, or we just usually assume that it is a female factor issue. In fact, many male fertility problems get overlooked or undiagnosed and are not even treated because of this misconception. The incidence of male factor infertility is actually on quite a rise. Especially, we see it in cities nowadays because people or men are living in such high stress environments. That is why this Facebook, this session, and that is why we are primarily focusing on male factor infertility, so that we can cover maximum topics, and we have it in the form of episodes. So it's going to be very interesting. Today's Facebook live session is also going to be a little different and interesting from our previous sessions. It is going to be more like a virtual rendezvous, so, and it's also going to be very interactive. So, I am Dr. Pallavi Kalghatgi, fertility specialist and IVF consultant at Xenith Advanced Fertility Centre. And I am going to be in conversation with Dr. Mamta Dighe, director and chief IVF consultant at Xenith. And it is going to be very interesting and very interactive, and you and I, we are all going to get to talk to Dr. Mamta and get some very compelling insights about male factor infertility. So I'd like to get Dr. Mamta live as well. Hello, Dr. Mamta.
Hello, everybody. Thank you, Pallavi. Nice being here with a different pattern.
Yeah, we are going to be starting our male infertility series. I just spoke about it, and today we are just going to be talking about the introduction. So, before we start, ma'am, I would like you to say a few things, and then we can move on to talking about the topic.
Yeah, so just a few things. At Zenith, we are constantly trying to create awareness. I personally believe that it is only after good information that people will be able to arrive at informed decisions. And a lot is available on the internet, on Google nowadays, but actually understanding some nuances or the nitty-gritties kind of helps patients. And we thought that this is a very important topic where, usually the male factor infertility gets sidelined. And so we thought that let's have a series on this. This is a series, so don't miss out any part of these series, because we are going to talk about every small thing associated with male infertility. It's not just the semen factors, but the sexual disorders, the ejaculatory problems. A lot of this is going to come along as we have our next one on this next episode on this series. And we are also trying to make it interactive. Pallavi is also here, I am here, so that we can kind of have this feeling as if all of us are in this together and have as a question answer. So I think you're all ready to shoot, Pallavi. We can go ahead.
Yes, okay. I think the basic question is how common is male factor infertility in your practice? And to add to that, like if we can compare that statistically, what is the incidence of this? So is it somewhere in the same range?
Huh. Actually, yes, I think more or less it is in the same range. it has actually really been undermined. We haven't really looked at male factor infertility so much. I remember when I started practicing infertility about 25 years back, all investigations, people would focus on the female without looking into the male factors. Also, the treatment would start. But luckily, a lot has changed. If we look at the incidence, statistically, about 20 to 25% of the cases of infertility are related to purely a male factor infertility. And about another 20 to 25% are factors which are related to both female and the male, which means that the male is also contributing to nearly 45-50% of the causes of infertility. So male factor infertility is as important as the causes in female, and its incidence is nearly equivalent to that of female infertility. I also want to say here is that the male infertility problem is also growing. I mean, we know globally that the incidence of infertility is increasing, but the incidence and the problems with sperms are also increasing. And a lot of it sometimes is environmental also. So you can't really do much about it. But male factor infertility is not only important contribution, but it's also on the rise.
Okay. So then, in that case, what would you say are the most common causes, or like just the top four causes of male infertility?
I think most of the times the common cause is idiopathic. Idiopathic is where we don't know what is causing the problem. So it could have been some infections in the past, some trauma to the testis in the past, hormonal disorders during the growing up period, mumps during adolescence, tuberculosis. So there are many factors which go missed. We don't understand that these things have happened in the past. At times, it is purely idiopathic. We really don't know what has happened. And these idiopathic causes could just be related to obesity, it could be related to nutrition, it could be related to pollution, environmental factors, increasing global warming, because a lot of things are contributing. I remember there was a place where a lot of pesticides used to be used. This was in Spain when I was visiting an IVF center. They told me that all these people coming from a particular area had poor sperm and they didn't know why this was happening. Then they realized that there were a lot of orchards around there and they were using this pesticide. So we really don't know what food we are eating, what water we are drinking. So that all is contributing. So idiopathic, which probably could be due to all these other factors. The other thing is hormonal imbalances. Sometimes there can be hormonal imbalances. The fourth is varicocele. At times, the veins that supply blood to the testis enlarge and there is stagnation of blood. So the testis does not get a supply of good and fresh blood, and hence the testicular production of sperm start getting affected. Also, there are cases where there is complete azoospermia, where there are no sperms. And again, there are different causes for it. It could be obstructive or it could be non obstructive. So, these are the common reasons why male factor infertility exists and is also probably, we're getting to see it more often now.
Okay. So then, when you say that maximum percentage is idiopathic, so idiopathic means there are n number of reasons, lifestyle, obesity, etc. So, are there any lifestyle changes that a man can follow to improve this sperm count, or the sperm basic sperm quality? Dr. Mamta, the fourth question was,
Your voice
yeah,
is breaking a little, Pallavi.
yeah. Am I audible now?
Yeah, the lifestyle changes, right?
Yes, yes.
Yeah, so I think I've got your question right. So let me talk about the lifestyle changes. A very, very important factor is truly lifestyle changes. One is, if we break this up as lifestyle changes, what are we really looking at? One is nutrition, two is exercise, three is sleep pattern, and four is usage of alcohol, smoking, high amount of caffeine, etc. I think these are the four factors that we can divide the lifestyle changes into. And of course, fifth, I would say, is stress. Okay. So let's look at each one of these factors. So, why is nutrition important? Frankly, I feel that your gut is truthfully controlling a lot of things in your body, not just your gut, your brain, your reproduction, so many things. And in some ways, nature has provided all the ingredients that we actually need to improve everything in our body. It's just that we are not aware of it, we don't pay attention to it, and probably with the way that there are changes and pollution, we are not getting the required nutrition from it. But what is important to understand is that nutrition plays a huge role. So what can you incorporate in your diet in order to have or maintain a good healthy sperm count? I think one is a lot of fruits, colorful fruits, all the ones that give you a lot of vitamins are very, very important. The second is, we are advised to take a lot of these nuts, berries, which again are very good source of antioxidants and can help the sperm count. Plenty of water is something that I would always advise everybody. Celery is one more food item that we encourage males to take. And we have a lot of videos on our YouTube channel which focuses actually on the exact types of food that one can take in order to help with the egg count as well as with the sperm count. So this is a part of nutrition. Why exercise? Because we know that if there is obesity or a high BMI, this is going to cause a slight increase in the estrogen hormone present in the man. And this could therefore lower testosterone levels and hence lead to maybe problems with the sexual dysfunction and sometimes even with the sperm count. So, having and maintaining a good, proper BMI is extremely important. The third thing is sleep. Why sleep? Is because we know that a lot of hormones in our body are controlled by this diurnal pattern of the hormones, and all these hormones are being secreted through the brain, which act on the testes. So, having a good amount of sleep is extremely important for proper sperm production from the testes. And again, like I said, excessive alcohol and smoking in any format, the nicotine has a lot of effect on the DNA that is present in the sperms. So if there is a history of smoking or alcohol or a high amount of caffeine intake, this is something that people must avoid. Again, if there is a history of wearing very tight undergarments, using very hot or warm water baths for a very long time, like tub baths for a very long time, because the testis should not be exposed to a very high amount of temperature, high temperature. So that is these are few of the things that people must take care, and these lifestyle patterns where you can manage your nutrition, your exercise, your sleep pattern, smoking, drinking, other patterns, and take care of your stress. This will go a long way in making sure that the sperm quantity and quality is also maintained.
Okay. So if lifestyle can change so much, I think everyone should start really taking those small steps where they can actually improve in their sperm quality in a very small way. So that was very, very informative. So I think the next basic question is that what is that primary test that can determine whether there is a male factor infertility involved?
Frankly, the primary and most of the times the only test that is required is a semen analysis. So the man has to provide a semen sample by masturbation. There has to be a gap of 3 to 5 days in the sexual intercourse activity. So there has to be an abstinence period of about 3 to 5 days before the semen sample is given for analysis. The semen sample is then inspected under a microscope using certain chambers which will give you the correct understanding of the count, the motility, etc. So there are certain factors that we look at in a semen sample. Very often, things have of course changed now, but I remember back then we used to get semen samples where the count was like, let's say, 30 million or 40 million, with absolutely poor motility. But the motility would not even be looked at. So there are certain parameters that you have to look at in the semen analysis. There are many other parameters also, like the presence of fructose and other things. I'm not going to go into these details, but the few most important things first is the count. So, according to WHO, a man should have at least about 16 million sperms per ml in the semen. Now, suppose this man gives us a semen volume of 2 ml, we will automatically get a sperm count, total sperm count in the ejaculate of about 32 million. So it has to be about 16 million per ml. And the amount of sperm or semen that is ejaculated in one ejaculation varies anywhere between 1.5 to about 3.5 ml. So that will decide the total quorum of the sperms that will be available to us. That becomes the count. The next thing is the motility. Now, why is motility so important? It is because only motile sperms will be able to travel up from the vagina. As we all know that when there's intercourse, the ejaculation is going to be in the vagina. Now, these sperms have to do all the work to travel from the vagina, through the cervix, through the uterus, into the fallopian tube. So, unless these sperms are motile and rapidly motile, it is going to be difficult for these sperms to reach the eggs. And therefore, we have gradations in the motility, like rapid motility, slow progressive motility, non progressive motility, and immotile. So, you have to have the progressive motility sperms in a good amount in the semen. Usually, the count that we expect, the percentage that we expect is at least about 32% of forward progression motility has to be there in the semen sample. And the third most important thing is the morphology. The morphology is the way the sperm is structured. It is the structure of the sperm. Now, the sperm has a head, it has a middle piece, and it has a tail. All these three parts are very important in the process of fertilization. So the morphology, that is the structure of the sperm, has to be good. We are always going to get some sperms which are abnormal. In fact, a lot of sperms are going to be abnormal if we check it by a strict criteria. But we should have at least a minimum of 4% normal sperms in a semen analysis for the conception to take place. So these few are the few things that we look at a semen analysis. Of course, if we get some abnormality in the semen analysis, we advise further steps, but the basic test is a semen analysis. Before I forget, a semen analysis should always usually be repeated twice. You don't go by the semen count just on one semen analysis, especially if it is a poor sperm count. So you always probably should get two semen analysis done to ensure that this is the correct count, motility, and morphology of the semen.
Okay. So when we talk about women or female, we always talk about the decline in the fertility potential in a female. So is that applicable to men also? Do their fertility potential also decline with age?
I think one word that people are really unaware of is andropause. everybody knows about menopause, but hardly anybody speaks about
Yeah.
andropause. So, yes, the testosterone levels, the sexual activity, the hormonal changes occur in men as well. It's just that they occur much later in men compared to women. And usually by that time, the whole reproductive planning of the couple is over, because this does not usually happen till the man crosses the age of maybe 50 or so. And sometimes it may not happen even at that age. So usually by then the family is kind of, if you're looking at the reproduction part of it and not just the intercourse or the sexual aspect of it, most of the times the family, the children, the planning the family is usually done. So yes, this does affect men as well as it affects women, but unfortunately it starts early in women compared to men, and hence it affects fertility most commonly in women more compared to what it affects in men.
Okay. Um, a very important question, I think. Again, not we always talk about women taking folic acid as prenatal vitamins. So, is there anything, any supplementation or any prenatal vitamins that a man needs to take when the couple is trying to conceive?
I think if the nutrition is managed very well, and if the semen analysis is normal, no, a man does not need to take any other extra supplements in such cases. But if the semen is affected, if there is low sperm count, if the motility is low, under such circumstances, antioxidants are medications that usually help a lot of these factors. And there are various antioxidants like coenzyme Q, lycopene, astaxanthin. Many of these are present in the formulations that are available today. But in a man who is following a good lifestyle with good nutrition, no smoking, minimal alcohol, good exercise, good sleep pattern, and avoiding all, like I said, exposure to a lot of heat around the area of the testicles, then in such cases you do not need extra supplements in the man. So you have to see, one very important thing that I would like to bring out over here is that there is this huge thing about using antioxidants in males. Okay, anything that happens, we are writing antioxidants, but we need to understand that some kind of the reactive oxygen, we call it the oxidation that is happening. So oxidation is usually considered as not good, and that is why we are continuously giving the antioxidants. That some amount of the reactive oxygen species and the oxidation happening in the semen is important and necessary for the whole fertilization and the whole pregnancy thing. So if we dump a lot of antioxidants when not necessary, it actually may really, I won't say do too much harm, but they are really not going to be helpful for the fertilization. So we have to be very careful about deciding which men should take the antioxidants and which men should not. So on a routine basis, no, one would not require it.
Okay. Okay, so say that a man is facing a lot of sexual dysfunction as well during their, intercourse, or if he is having issues of erections. Does that also mean directly, or is it directly proportional to him having a poor semen quality or a poor sperm count or something like that?
Yeah, I think that's a very important question, Pallavi. And it is a myth that if sexual function is completely normal, semen analysis is going to be completely fine, and vice versa. So, if sexual function there is a problem, either ejaculatory or erection problems, it does not mean that the semen analysis is going to be abnormal. So sometimes both can coexist. That can happen. But it does not mean that having some problems in sexual dysfunction automatically reflects as a poor semen count or motility or whatsoever. It is not like that at all. Now, why is this important to understand? One is because when it comes to sexual dysfunction or sexual function, there are a lot of things that are required. Everything is not physical. There are so many things that it could be psychological, it could be emotional, it could be the bonding. A lot of things could be a factor. Then, if it is physical, it could be related to other issues such as diabetes, hypertension, due to which erection can become a problem. And the third most important thing is that the cells in the testis that produce testosterone are different from the cells in the testis that produce sperms. So sometimes the testicular production may get affected, giving rise to some other issues, but the sperm production could be completely normal. So there are many reasons. These are only a few reasons causes that I have cited which can cause sexual dysfunction, but there are other causes as well which can cause sexual dysfunction. So it does not automatically mean that if there is a problem with the sexual function, there is going to be a poor semen count or motility. Yes, one needs to understand and go to the base or the cause of what is causing the sexual dysfunction and treat it. I'm saying this because I have seen that a lot of times, if there is an erection problem or if there is an ejaculation problem, directly treatments like IUI or IVF sometimes are resorted to. So it's very important to understand that under such circumstances, if the semen analysis is normal, all you need to do is treat the problem, which is at the core of it, whether it is erection or ejaculation or whatever. And most of the times, just by treating this, natural conception is possible. So these are two different things, but yes, a semen analysis should be done when you are also facing such issues.
Okay. So in that case, who would you say is an ideal doctor to consult in either cases, whether it is for fertility, for male infertility, or even for, a sexual dysfunction? So who would be an ideal doctor to consult?
you know, after calling ourselves gynecologists, we call ourselves as fertility specialists, but or reproductive medicine specialists. But there's a very, very important reason behind this, because as gynecologists, we are used to treating only women. We don't look at males. But as reproductive medicine specialists, we are trained to look at both the male and the female aspects of infertility. Yes, we may not be able to treat everything in the male, I mean, in regarding other complications or other issues, but as far as the reproduction is concerned, we are trained to look at male factor fertility, male reproduction, as well as the female factor. So the answer to this would be definitely you need to see a reproductive medicine specialist. I think I would also want to bring out something over here is that when I started out, there wasn't really the training that used to be available. It used to be, but now we have all these degrees where a person actually studies reproductive medicine, tries to go into the depth of every problem, and hence is in a much better position to deal with it. So the answer is a reproductive medicine specialist or or an andrologist. So an andrologist is also part of the reproductive medicine specialist, but this person will focus only on the male, whereas a reproductive medicine specialist will look at female as well as the male issues, but an andrologist mainly looks at either sexual ejaculation or fertility issues. So I think my answer definitely would be that go and seek out a good reproductive medicine specialist or an andrologist. Like at our center, we have reproductive medicine specialists who have trained in reproductive medicine, as well as andrologists. So, depending on what is comfortable, because sometimes you need to examine the males. That is a very important thing. Many a times now, because of the investigations that are available to us, we skip all these small things between
I think we are facing some problem. Okay, so I think there is an issue with the network with Dr. Mamta, and I think she's back. Yeah. Yes.
Hello.
Well, yeah.
Yeah, sorry, some technological glitches.
Okay. So,
I am
yeah.
audible, right, Pallavi?
Yes. Yes. Yes, Dr. Mamta.
There is a bit of lag. All right.
Okay, I think that answer was really that really cleared a lot of the confusion in about an andrologist and a reproductive medicine specialist, because we get a lot of patients asking us, is it the same thing, or are we dealing with a completely different problem? Whom are we supposed to show? So I think that question was very much needed in today's introduction. I think our last question is, can you give us a few quick tips that a couple can follow, or deal when a couple is dealing with infertility? What are some few quick tips that they can follow?
Mm, quick tips for both of them. I think probably it's the same thing over and over again, because I would again say that for them, it's important that they maintain their nutrition, exercise, they take care of their mind, emotions, personal relationships, because everything is causing a whole dynamic between a conception. We have to understand that it's not just an egg and a sperm, it's the creation of a life. And if you look at, there is going to be an environment to be created for the nurturing of this life. That is important. So I would say that it is very, very important to nurture your own self, to nurture your partner, to nurture your body, to nurture your mind, to nurture your emotions, to nurture your environment, and to nurture your relationships. So I think there is something that, people, we should try and go above the just take a folic acid pill when you want to get pregnant. So I would say am I audible again?
Yeah.
I don't know why this is happening.
Okay.
Am I audible, Pallavi?
Yes, 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 ma'am. You are audible now. Let us quickly take
Yeah.
any
Okay.
questions if we
So
have any.
I'll just one minute I'm going to say for everybody, the nutrition, exercise, all the things that I said, take your folic acid supplementations. That is very, very important. And try and understand your fertile period. So if you do these few things, I think that is about it, that you can really take care of whenever you're planning for the pregnancy. Yeah, so if there are any
Okay.
questions, we can
Yeah.
take them quickly.
Yes, let me just have a look. Yes, we have one. So, okay, this is again a very good question. Are there any symptoms that are associated with male infertility?
Not really. Not really. That's the reason why male infertility gets missed so often, right? So, not really. With sexual dysfunction, you will obviously have the symptoms of the dysfunction, the anejaculation, erectile problems. But infertile male can be perfectly healthy. In fact, sometimes much, much more healthier, because there are a lot of people who take all these medications for muscle growth and all that, so they actually may be much more healthier. So no, not really, there aren't really any symptoms as such associated with male infertility. Yes, there could be telltale signs. I'm not saying that you can't find certain signs, but for the person themselves to understand that, okay, when this happens, this means that there is infertility, there aren't really any symptoms like that.
Okay. And I also think that we'll be talking about this more in detail in our consequent episodes on this series. So we'll be talking about it more in detail. We have another question. How is male infertility diagnosed? Again, this is something that we will be talking about in detail, but can you just tell us quickly, if just like in brief, if there is what is the easiest way? Like we already spoke about the semen analysis, but is there like a hormonal profile like we have in women? So is there something like that in cases of men, and what are the usual hormones that could have a dysfunction?
The hormones in male are only looked at if there is an abnormality in the semen analysis. We wouldn't go around checking the hormones for every male. So yes, if there is a problem with the semen count, motility, etc., there are certain hormones like the follicular stimulating hormone, the luteinizing hormone, and testosterone that we look at. Prolactin hormone, which usually causes a problem in females, causes a problem in the male only if the prolactin levels are extremely high. So I would say hormone levels in males are done only under certain specific conditions, and the three main ones are the FSH, LH, and the testosterone.
Okay. Okay. So yes. Okay, we are not looking at any other questions. I think it was a beautiful session, an introduction session, and thank you so much, Dr. Mamta. This was actually a very great start to this series, and we are going to have many, many more episodes on this series where we are going to talk in detail about, male infertility, what are the symptoms, like we said, what are the treatment plans, what are the different options that are available, and so on. And to get to get updates on our future episodes, please follow us on Instagram and on Facebook, and you can also subscribe to our YouTube channel where you'd be getting all the information. uh, I thank all of you for attending today. Thank you so much, Dr. Mamta. And I think it was very nice and very informative. Do you have any last words to say?
No, really, thank you, Pallavi. I think you picked up very good questions. I was wondering what all you're going to ask, but very good questions. I think the final thing is that we can hopefully get across the importance of the male factor in infertility and address some common queries. Try to take care of certain myths that are get propagated So through this series, as long as we are able to do that, create the awareness and, help them sort out the important from the trivial, I think that would be a job well done. So thank you so much, and I hope that this really has helped you and helped our listeners in some way. And hopefully, y'all will keep joining us, and we'll keep bringing on more about male infertility as this series goes by. So thank you, Pallavi, and wishing everybody a great weekend ahead.
Yes. Have a happy weekend, all of you. Thank you.
All right. Bye bye. Yeah.
Bye.